who should get the BCG vaccine for TB prevention. Imagine a world where a simple shot can help protect some of the most vulnerable from a serious disease. That's what the BCG vaccine aims to do for tuberculosis, or TB. But it's not for everyone. The decision to get this vaccine depends on specific risk factors and individual circumstances. The BCG vaccine is mainly recommended for children who have a negative tuberculin skin test and are at high risk of ongoing exposure to untreated or poorly treated TB. This means if a child lives in an area where TB is common or is in close contact with someone with active TB that isn't being properly treated, they might need the vaccine. It's especially important if they cannot be separated from the infected person or if long-term preventive therapy isn't possible. Children exposed to TB strains resistant to key medicines like isoniazid and rifampin may also be considered for the vaccine. In regions with very high rates of new TB infections, more than 1% each year, where other control measures aren't enough, the vaccine can be a helpful tool. In the United States, the vaccine isn't given routinely to everyone because the risk of TB infection is low. Plus, the BCG vaccine can interfere with tuberculin skin tests, making it harder to diagnose TB if it develops later. Instead, it's reserved for specific cases after careful consultation with TB health experts. Healthcare workers working in settings with a high chance of encountering drug-resistant TB might also be considered for vaccination, especially if infection control measures haven't fully stopped transmission. But it's important to remember that the vaccine is mainly effective at preventing severe TB forms in children, like TB meningitis or widespread disease, rather than adult lung TB. People who are immunosuppressed, such as those with HIV or pregnant women, should generally avoid the BCG vaccine because it's a live vaccine and could pose risks. In summary, the BCG vaccine is best suited for children at high risk of exposure in certain settings and for healthcare workers in specific high-risk environments. It's not recommended for the general population in low-risk countries. Always, the choice to vaccinate should be made with guidance from health professionals who understand the individual's exposure risk and local TB situation. If you think you or your child might need the vaccine, talk to a healthcare provider to get personalized advice based on your specific circumstances.